minerals, as opposed to vitamins, we need less minerals than we do vitamins in our body. But minerals are defined as an inorganic element that's present in soil and water, which are absorbed by plants and then consumed by animals. So we put minerals into two categories. There's major minerals and then there's trace minerals. Major minerals are sodium, potassium, chloride, calcium, phosphorus, magnesium, and sulfur. And then trace minerals are going to include iron, copper, zinc, selenium, iodine, chromium, fluoride, manganese, and molybdenum. We will go over each of the different minerals, the foods that we can find them in, and then what can happen if we become mineral deficient. Because just like vitamins or any of the other nutrients, proteins, carbs, lipids, if we are deficient in certain minerals, that can lead to health disruption. So let's start with calcium. Calcium can be found in yogurts, cheeses, sardines, milk, orange juice, turnips. Their function in your body is they are a component of mineralized bone and provides structure and microarchitecture. So basically that's going to involve architecture or helping support the cell. We've also learned how important calcium is in muscle contraction activity. Deficiency diseases or symptoms, osteoporosis is going to be a disorder that involves low levels of calcium. Phosphorus is the next one. Salmon, yogurt, turkey, chicken, beef, lentils are good foods that supply phosphorus. Its job is it is a structural component of bones of your cell membrane and also an important ingredient in DNA, RNA, and ATP. Deficiencies can lead to bone loss and weakness. Sulfur can be found in any food that contains proteins. They are going to be the structural basis for some of our vitamins and also amino acids. They also play a role in acid-base balance. And there is going to, it's really difficult to have a sulfur deficiency if you're getting enough protein. So typically it's not an issue. Magnesium can be found in whole grains, legumes, almonds, cashews, beets, kelp. It is a component of mineralized bone as well. It plays a role in ATP synthesis, so how we make ATP, how we use ATP, and then also how we make and use carbohydrates, lipids, proteins. It also plays a role in DNA and RNA synthesis, so how we make those compounds. Deficiencies would include tremor, muscle spasms, loss of appetite, and nausea. Iron is the next trace element. It can be found in red meat, eggs, any kind of dark leafy vegetable, dried fruit, and then we often fortify or add iron to many of our foods, especially cereal. It assists in energy production, DNA synthesis, and it is required for blood cell formation. So having not enough levels of iron would lead to anemia, fatigue, paleness, increased heart rate, and cell function would also be disrupted. Copper, found in nuts, seeds, whole grains, and seafood, assists in energy production, also in metabolizing iron. So low levels of copper would also lead to anemia, fatigue, paleness, and an increased heart rate. Moving on to zinc, found in oysters, wheat germ, pumpkin seeds, squash, beans, sesame. This is going to play a role in energy production, protein, RNA, and DNA synthesis, and it's also required to make hemoglobin. Deficiencies in zinc would lead to slow growth in children, hair loss, diarrhea, skin sores, loss of appetite, and weight loss. Selenium is found in meat, seafood, eggs, and nuts. It's essential for thyroid hormone activity, and deficiency would lead to fatigue, muscle pain, weakness, or a disorder called Cushing's disease. Iodine is found in our salt, seaweed, dairy products. It is also an important mineral in thyroid activity. It makes the thyroid hormone and then plays a role in metabolism, growth, and development. If you have a deficiency, you would have a goiter, cretinism, fatigue, depression, weight gain, itchy skin, and low heart rate. Chromium, found in meat, nuts, and whole grains. It assists insulin in carbohydrate, lipid, and protein metabolism, so it works alongside insulin. And low levels would indicate abnormal glucose metabolism, so we're not breaking up the glucose the way that we should. And finally, fluoride. It is going to be found in fluorinated water, and then foods that are prepared in fluorinated water, and seafood. Adding fluoride to our water supply can be a pretty controversial issue. Some communities do. The city of La Crosse does have fluorinated water, but it tends to be a battle about whether or not a city should put fluoride in water or not. The reason we want to put fluoride in our water is that it's a component of mineralized bone. It provides structure and microarchitecture. It stimulates new bone growth. So if you have well water, you are getting that fluoride in there. So typically if you live in an area with well water, when you go to the dentist, they'll ask to do a fluoride treatment because it does play a pretty important role in keeping your teeth strong. And deficiencies can lead to an increase in dental cavities. So those are the major minerals, where you can find them, and then what can happen if you do not have enough of them.